Hi everybody, welcome to the Centre for Public Health Research seminar series. It's really good to see lots of people here and quite a nice mixture, so hopefully after the seminar we can have a really good discussion as well about Katie's work. Presenting for us today is Katie Powell. Katie is in the final year of her PhD now and is going to present us with an update of her work. So I will pass over to Katie. Thank you.
Thank you very much, Diana. Thanks everybody for coming along today. It's very nice to see so many familiar faces and also some people who I haven't presented to before, so hopefully some of this is new to at least some of you. But I will be presenting some findings today. This project's anticipated to be completed at the end of the year, so the analysis is very much ongoing. And the aim of the project is to try and improve understanding in relation to area-based initiatives. And I'm seeking to do that by exploring some of the processes associated with one particular area-based initiative and using a particular sociological perspective to explore some of those processes related to this initiative. And the perspective I'm using is informed by figurational sociology. So I'll say a little bit about that in the presentation. I'm just thinking that perhaps I need a more interesting title for the project, but that's what we're working with at the moment. So, the research is focused on target wellbeing then, which is an area-based initiative in the Northwest. So the first thing I'm going to do is provide some background information in relation to target wellbeing. I then want to very briefly touch on some of the limitations within existing knowledge relating to area-based initiatives, and then try and demonstrate how my research can add to understanding about area-based initiatives or ABIs by, as I said, exploring some of the processes of change related to these initiatives. So the findings that I want to talk about today relate to power dynamics amongst providers within the initiative, and then in particular some of the constraints imposed on those providers. And then I want to talk about some of the processes of change for residents, and I'll talk about development and use of power through social networks in particular. So, target wellbeing then is an initiative that was put together under the last Labour government via a bid to the big lottery. It's targeted at areas of disadvantage across the Northwest, and there are 90 individual projects altogether across the whole programme, but they're being delivered within area programmes across 10 areas within the Northwest. And the aim of target wellbeing is to improve the health of residents in the areas that are targeted, and the projects all relate to one or more of these themes of increasing physical activity, improving healthy eating, or improving mental well-being. And the projects are primarily being delivered by the community and voluntary sector, or the CVS. And the projects include things like a community walking programme, there's a food growing project, and also a project that runs courses to help people who are long-term unemployed get back into employment. So those are a few examples. As I said, this was developed under the last Labour government. And under Labour, area-based initiatives were defined as publicly funded initiatives targeted on areas of disadvantage which aim to improve the quality of life of residents living there. And under Labour, there was this particular interest in improving local services, improving access to services and trying to better coordinate local services to improve the quality of people's lives. And some of you might be familiar with things like health action zones and the New Deal for communities. And projects like this involved a range of different activities. There was a big emphasis on partnership working between local services, and they sought to address a range of different social problems in deprived areas, but health was a specific focus of many of these, as it is with target wellbeing. So as I've said, there was this interest in coordination of services and improved access to services for people living in deprived areas. And that corresponded with an interest in the CVS as a means by which local people might be engaged with services from which they might benefit. And this interest in the CVS was underpinned by government claims that the CVS was much better than the statutory sector at engaging with groups of people who face most difficulties or who don't access traditional sources of advice on health. So there's this idea that something might be different about the way in which the CVS operates. And although the coalition government have intimated that there will be less of an emphasis on short-term government-funded initiatives, I think the interest in localism and certainly the role for the CVS in engaging people in services, that those things have remained on the policy agenda. So I think the research is still relevant to current policy. So, as I said, I want to talk briefly about what's already known in relation to area-based initiatives. And despite this sustained policy interest in an area-based approach to addressing health problems in deprived areas, there is uncertainty about whether or not this approach is effective in improving health outcomes. And this is largely due to problems with their evaluation, and in particular to what we might call an under-theorising of the area-based approach. So typically, as I've already hinted at, these initiatives involve a range of strategies and activities, and that they're seeking quite often to target a range of social issues, which makes it quite difficult to try and make links between programme outcomes and programme activities. So there isn't necessarily a theory about the way in which a programme should work always. Related to this, as yet there's very little evidence to suggest that the CVS does have distinctive characteristics that might shape public services in particular ways. So this interest in the CVS and their involvement in public health seems to raise some questions about patterns of service provision. So that's something I want to explore. I also want to note that because these kind of interventions take place within a social context, it's been difficult for evaluators to attribute any changes within an area to a particular initiative. So within any area, there'll be policies and other initiatives operating that make it difficult to disentangle kind of cause and effect, if you like. So what I want to suggest is that it might be more realistic to think about planned and unplanned outcomes within an initiative, and explore some of the processes that might be connected to those outcomes. So I think there's a need for research to examine the processes related to these kinds of initiatives and recognise that there might not be a straightforward causal relationship and that change might be more complex. So Pawson and Tilley, who advocate a realistic approach to evaluation, suggest that within the social space of any particular intervention, there'll be social rules, norms, values and interrelationships that already exist that will constrain or enable particular mechanisms of the programme. So those particular devices through which the programme's anticipated to operate will be constrained or enabled by what we might think about as the social context. So rather than thinking about the social context as a backdrop, I want to think about how the particularity of that particular context might shape the way in which the initiative develops. So, as I said, the research is exploring the mechanisms of change that happen within a particular social context, so within one town targeted by target wellbeing. And I am essentially exploring how is it that an area-based initiative might operate. So, I would argue then that what we need is a better understanding of some of the processes that might be operating at the spatial scale of an intervention. So we need to think about what's going on in deprived areas that might influence poorer health outcomes, and then consequently build to an understanding about how an area-based initiative might intervene in some of those processes. So traditionally, research that seeks to explain why people in deprived areas have poorer health outcomes separates what might be called contextual and compositional factors. So that is, things that might be considered to be related to the environment or the context, and things that might relate to specific individuals or their composition. And quite often these processes are explored independently of each other and then measured to test their differential impact on health. So, for example, lots of social science research separates out ethnicity as a compositional factor, and then explores things in the social context, like the ways in which services are organised, and explores their impact on health. But more recently, attempts to explore the relationship between places and health have sought to try and capture what might be thought of as a reciprocal relationship between people and the places in which they inhabit. So in this instance, ethnicity is recognised as a social construct, and it's recognised that it only has meaning in relation to other people, and that might therefore be affected by where people live. And likewise, organisation of services, rather than being seen as something external to local people, can be seen to reflect social norms and values of people within a particular area. A lot of these ideas build upon conceptualisations of place that come from social geography, that thinks about places as a constellation of human interaction, if you like, a site in which the ways in which people are connected and interact comes together. And the sociological perspective that I've used within this research, I think, builds upon some of those ideas and takes as its starting point the interconnected nature of human experience. So I did want to very briefly touch upon the social theory that I'm using, because I want to demonstrate the ways in which that's helped me understand a lot of the data that I've collected within this project. So I'm suggesting that figurational sociology provides a framework within which to explore the ways in which target wellbeing is implemented. And the central organising concept within figurational sociology is that of a figuration or networks of interdependency between individuals. So as individuals are independent with a range of different people, they can be viewed as forming webs of interdependency with others, and these webs can exist. People can be parts of many different webs at any one time. So these webs of interdependency might reflect connections with family, with friends, with people in a neighbouring area, but they might also represent what I might think of as functional dependence, with people whom they never have face-to-face contact with. So, for example, if we think about the ways in which policymakers are constrained in the policies that they can make by individual behaviour, and then simultaneously the ways in which individuals might then be constrained by policies that operate in areas where they live, we can start to think about this kind of mutually dependent relationship between people at different levels. So these interdependencies operate at various spatial scales and can extend to large numbers of people. And in relation to an area-based initiative, we can think about local residents as being interdependent with one another, with service providers, with politicians and so on. But we then also recognise that service providers are constrained in their behaviour by their interdependencies and connections to local residents. So I then want to suggest that because of these constraints enforced on people's behaviour, because of their connections to others, we can start to see how planned action, such as that within an intervention like target wellbeing, might not lead to predicted outcomes because we're thinking about the interweaving of different actions between different people. Hopefully when I talk about some of the findings, this will start to make a little bit more sense. Essentially, I think what I need to say here is that what I want to do in my research is explore the ways in which people are interdependent within the town targeted by the initiative to try and explore some of the processes related to target wellbeing. So I'll just explain briefly the methods used in the study. I've taken a case study approach looking at one particular town targeted by target wellbeing. I've tried to explore the development of this initiative over time using non-participant observation of target wellbeing activities with local residents, meetings between people involved in the initiative, those sorts of things. And I've also carried out face-to-face semi-structured interviews with a range of people within the town, including project staff, so those people delivering the activities, people who I'm going to refer to today in the findings as initiative coordinators, those people who had a more strategic role within the initiative. I also spoke to local service providers, people already delivering services in the area before target wellbeing was implemented. And then I'm also drawing on some findings today from interviews with project users, those people, local residents who'd engaged with target wellbeing. As part of this idea of trying to trace the development of target wellbeing over time, I also carried out documentary analysis on documents relating to the initiative, so things like monitoring reports that were put together, minutes from meetings between members of staff involved in target wellbeing, and also interrogated quantitative data that was recorded by the projects, information about the demographics of their users, attendance registers, those sorts of things, trying to gain an understanding about the reach of target wellbeing within the town. So hopefully this demonstrates that I'm trying to explore implementation of target wellbeing on two levels. Firstly, amongst service providers and exploring how target wellbeing fits with existing provision in the area. And secondly, amongst residents. So thinking about the ways in which people are engaged in target wellbeing and what sort of impact engagement has on their lives. I think I need to say a few more things about the context of the local programme before I move on to the findings. So organisations in and around the town were invited by the local strategic partnership covering the area to put together a project that might improve the health of local residents. And 8 projects were chosen, 5 of which might be thought of as new projects, and 3 of which were already operating in a different area and were transferred into the town. So 5 of them were newly created under the Target Wellbeing banner, and 3 of which were already operating elsewhere. Those 8 different projects were delivered by 6 different organisations, so 2 organisations had more than one project. And it seems that I've made a distinction between those organisations that were more established in the local area, so they had experience of working in the particular town, and organisations that might be thought of as more new to the area. They had less experience of working in the town and were based outside of the town. So 5 of them were CVS providers and 1 of them was funded by the statutory sector. And funds for target wellbeing within this town were managed by the local primary care trust, who oversaw the general management of the projects. Now, I don't anticipate that you'll be able to make much sense of this slide, but I wanted to try and demonstrate some of the complexity in terms of the implementation of target wellbeing, and also to show this slide that I worked quite hard putting together. But what this is attempting to illustrate is the nature of interdependencies between service providers within the area. So there's people already operating in the area and the Target Wellbeing Project staff. And this has been helpful because the findings indicate that in order to get their projects established in the area, the Target Wellbeing staff were reliant on existing service providers. So to get their projects established, lots of the projects were quite dependent on referrals from existing services. And quite often, the projects talked about tailoring what they were delivering to the particular needs of these providers. So, for example, lots of the projects wanted to do work in schools. And during interviews, the project staff talked about adapting their activities to meet the curriculum needs. And related to this, staff at more established organisations perceived that their reputation had facilitated access to support from some of these existing organisations. So one such staff member from the Target Wellbeing Project within an organisation that had worked in the area for some time described the projects at her organisation in the following way. She said that they're not standalone projects that have got to spend years making their mark. They're already joining something that has a local reputation, already having links with organisations. Schools don't just want anybody coming in and working with their pupils. So as I've said, this demonstrates the ways in which some of the project staff perceived that their reputation facilitated access to support from existing organisations. Conversely, some of those projects within organisations that were new to the area reported experiencing hostility from existing providers. So one such project staff member reported that some local organisations had expressed doubt in the project's ability to be able to engage local people. And this particular project staff member suspected that some of the local organisations preferred to refer to organisations they had connections with rather than these new Target Wellbeing projects. One Target Wellbeing Project staff member at a more established organisation said that her staff preferred to refer to participants within organisations with whom they had an established relationship rather than new Target Wellbeing projects. And interviews with existing local service providers revealed that there was some agitation that organisations from outside of the area had been chosen to deliver some of the Target Wellbeing projects over more local organisations. And the following quotation isn't typical, but I think demonstrates the fact that there was some suspicion over what might be termed outside organisations. So one local service provider said, "I think Target Wellbeing should have been more local than maybe it was. This particular organisation is not local, so it's difficult. I mean, it's not even just difficult if you're not local to come in and deliver, but it's do they care? I mean, I do what I do here, and I care about it because I live here. I want there to be good services. If I didn't live here, would I care in the same way, or would it just be about the money?" So I think that in order to understand the implementation of Target Wellbeing, it's been useful to explore power balances within the area. And it seems that more established organisations had existing relationships with service providers and a reputation as established within the area that assisted that process of securing resources via the social network. Organisations that were new to the area perhaps had fewer resources in order to set up their project. So I think these findings demonstrate some of the complexity of implementing an initiative like Target Wellbeing and demonstrate some of the ways in which service providers might be interdependent. And this concept of established and outsiders that's a figurational concept, I think can partly explain the balance of power within the network of interdependencies between providers and show how this has shaped the development of Target Wellbeing within this particular town. Another theme within the data was that of competition between the projects. So bid documents relating to target wellbeing and interviews with staff in more strategic roles illustrated that target wellbeing was intended to operate via a network of social relations between the projects. So it was anticipated that coordination of activity between the projects would raise local awareness of target wellbeing and also would increase the capacity of the CVS providers to apply for future funding within the area and those sorts of things. But analysis of the data revealed a gap between this particular strategy and the experience of implementation. So project staff, for example, during interviews sometimes said that they had little knowledge of other projects within the programme. There were some examples where projects had been working within the same schools but said that they'd been unaware that other target wellbeing projects were operating there. And project staff perceived that competition between the projects had in some instances constrained joint working. Project staff talked about fears about engaging in joint work that wouldn't directly contribute towards their particular project's targets. This quotation from one project staff member, I think, demonstrates this. He said, "I just don't think we're talking to each other as well as we could in terms of projects. And I think part of that is the fear of crossing over users because we don't quite understand whether we can still count them." Some local service providers suggested that project staff were very focused on their own specific project targets without reference to any wider aims for the wider programme in the area. And this was supported by interviews with the project staff who said that projects got on delivering with what they said they would deliver and also said that projects delivered to their own agendas. And staff also talked about fears that their work with other projects might overlap, and some of the project staff voiced ambitions to extend their work into areas currently being covered by other target wellbeing projects. And some of the target wellbeing coordinators expressed surprise that the CVS organisations hadn't worked together more closely. Somebody said that they'd anticipated that the projects would work towards a greater good with less competition. And I think, again, these findings suggest that it's helpful to think about the wider network of relations in which the organisations are already immersed, which might limit their capacity for action within this particular initiative. So, for example, consideration about the ways in which the organisations are interdependent with one another and within potential funders highlighted the importance that they attach to particular measures of successful engagement of residents, which they related to their survival as an organisation. So, as I said, I wanted to also talk about some of the processes of change for residents in the area. And target wellbeing project users were overwhelmingly positive about project staff during interviews. Several residents perceived that project staff were very committed to their work, which made it easy for people to open up to them. And this particular participant on a return to work course describes this. She says, "I just got talking to the project staff member about my past and where I went wrong with stuff. I mean, sometimes people do this job because they get paid for it, but she doesn't. She really loves it, and people find it really easy to take to her." So project staff said that this trust was developed through demonstrating reliability to their users. Staff at a project supporting people who'd experienced mental health problems said that they achieved this by always keeping to their word. So one staff member at that organisation said, "Staff are there when they say they will be. Clients know that if they have a problem, they can ring and a staff member will get back to them." And this was echoed in the interviews with users of this particular project. Users said that it was good to know that staff would always be there if they needed somebody to talk to. And this trust seemed to help facilitate the development of new social networks for residents and connections in particular with other local services. So staff seem to have been able to facilitate some of these networks with residents and local services. In some instances, these connections have been made by raising awareness in relation to other local services, telling residents about what was available locally. In some instances, residents hadn't previously thought that these services were available or appropriate for their needs. So someone, for example, who'd accessed the local Healthy Living Centre for the first time via a Target Wellbeing project reported that previously she perceived that those services were only available for single parents. And when Target Wellbeing participants talked about the new connections that they'd made, the role of the project worker was very often mentioned. And in several instances, staff had accompanied project users to a new service, such as the Citizens Advice Bureau, or to try and help them engage and enrol at the local college. And staff perceived that those personal introductions were very important, given that many of their users lacked the confidence to approach these services alone. And again, this was supported by some of the comments from project users. So one participant who'd accessed several new services via introductions made by Target Wellbeing staff said that she'd never been on a course like this before, and I was really, really nervous. It's to build confidence because I haven't got a lot. I'm a bit nervous, but I feel a bit better having been on the course. Me and my friend were getting in a rut just sitting at home. You think that's it, but it's not. There's so many different things you can do if you go and ask someone. That's the thing, isn't it? Asking about it. So again, in order to explain how residents were able to use local networks, I think it's helpful to think about the ways in which power balances between local residents and services were changed in the area. So staff had helped participants to build confidence and persuaded them of their right to access some of these services. And by providing information and making personal introductions, staff perceived that they were able to reduce some of the fears that residents had about accessing something that was unknown to them. So, just a couple more points about these networks. For many of the service users, the contact with the project was some of the only social contact that they had. And some project staff described clients who they were aware had difficulty initiating social contact outside of the project. Participants also talked about contact with services as providing something meaningful to do with their time. And this was particularly true of those participants who were unemployed. So when asked how they benefited from projects, several participants reported that it provided things to do. As this participant said, I don't have to sit in on the project courses. I just twaddle on down there, because I'm bored. It's something to do. And other interviews with project users indicated that some of these new introductions made to services might extend beyond the life of the project. And again, this suggests that the relationship between service staff and residents has been used to challenge resident ideas about what might be appropriate or suitable for their needs. So, to conclude then, I think these findings illuminate some of the processes through which Target Wellbeing is implemented and help to explain some of the ways in which project staff might facilitate change in the local area. The analysis suggested that this concept of established and outsiders might be helpful in explaining the power dynamics that operate within the initiative and have helped to shape some of the ways in which the projects have developed. So again, people within more established organisations had access to more resources that helped to establish their activities. And as well, exploration of the social networks of interdependence revealed that one of the unintended consequences of Target Wellbeing was that the CVS organisations saw one another as a threat to achieving their own particular targets. And I think this reveals that expectations about the role of the CVS within these particular initiatives haven't taken account of the other interdependencies within which these kind of organisations are already embedded. The research has also facilitated a better understanding about the ways in which local residents might develop and utilise power through social networks. So the findings indicate that trust developed between project staff and users facilitated efforts to change users' perceptions in relation to existing social services. And some residents had more confidence approaching services from which they might benefit. So I hope that further analysis is going to shed light on some of the other social dynamics operating within social relations within target wellbeing. That might help to explain a little bit more about what's going on. And I think I'll leave it there. Thank you very much.
Thank you very much. It was great as usual. I work with Katie in the office.
So you have to say that.
And it's always nice to hear exactly what she's doing, because she always looks very, very hard at work, but we don't often get a chance to kind of talk about the research and what's happening. So we're looking forward to you finishing your PhD and presenting some final findings next year, I'm sure. So we have got a bit of time for some questions now. Just before we get into the questions, just to say, just in case anyone has to slope off at the end, our next seminar is on the 11th of May, and it's one of our other PhD students within the centre, Rebecca, and she will be presenting on exploring local delivery to improve health and reduce inequalities, a sociological study of one local public health system. So yes, that's next time. But has anybody got any questions for Katie? Right, I'm going to hand this microphone round. It's for the purposes of the camera, so don't worry that it doesn't sound very loud. Thanks, Katie.
I suppose my question really was just how the changing government has influenced your project, or didn't it?
Right.
It must have done.
Yeah, I think it definitely has, because I think it's changed what's happening in terms of policy and activity within the area. So obviously there are different things operating within the town that target wellbeing is either connected to or not, if that makes sense. So yeah, I think this is an example of the way in which the social context changes and the way in which that affects how the initiative is rolled out. So there are some examples of new initiatives being developed within the town, which target wellbeing has had some links with. But it very much has changed the terrain in which the project staff are working, if that makes sense.
Yeah. Do you know how long the project's going to continue for? Have they got a sort of set point, or is it a bit of a rolling programme?
Yeah, some of them are extended longer than anticipated, I think. But the majority of them will finish, I think, December, is it? Yeah, there's none going on beyond December. Right, thanks. Most of them started, I think, in 2008, didn't they, at some point during 2008?
I just wonder how all of this ties into the big society idea, because it seems very similar about using social networks that are already in place, and whether you've done kind of any comparisons with the two. Because I'm from NHS World, and I'm looking at using the voluntary sector to deliver smoking services instead of traditional health professionals. And I've kind of come across the same thing, that there's going to be competition between providers instead of them working together. But at the same time taking the big society principles. And I just wondered if you'd covered that at all. Or
well, I think that makes my research very relevant still, the fact that so many people are talking about the big society. I suppose it makes it more relevant in that if there's going to be this emphasis on the community and voluntary sector, I think we need to understand more about what happens when you use community and voluntary sector providers. There seem to be a lot of assumptions about the ways in which the community and voluntary sector operate. And suggestions made that they work very differently to people in the statutory sector or private organisations. But I'd argue that the analysis here suggests there's lots of things that haven't been thought about that might mean that those CVS organisations don't quite work in the ways in which people imagine, because of real constraints on on how they operate, funding constraints and those sorts of things.
I think when we're putting them in a position when we maybe go out for expressions of interest or go out and only choose a small selection, it puts barriers in straight away.
Yeah.
So if one has been awarded a particular contract and another hasn't, they'll refuse to work with each other because of that. And it just kind of starts there. And it's looking, I find your research really interesting because it's looking at that first stage of when you engage the CVS and how not to create that competition early on. So it's very, very interesting.
Oh, good. Thank you. Thank you very much.
I just was curious about the projects as a whole, whether there was a mechanism in place with, between the CVS organisations for information sharing, because that was one of the issues that you raised, that they weren't sure or weren't informed about each other's projects, whether there was something in place.
As I said, Target Wellbeing was intended to operate via these kind of networks between the projects, and this idea that they were putting in programmes within the areas that they were focused on. The projects were encouraged to attend quarterly meetings with each other to kind of share information. Again, not all project staff were able to always attend those meetings. Sometimes it was a different project staff member from the particular organisation. And I think one of the interviews highlighted the fact that staff within these CVS organisations were delivering target wellbeing projects, but they were also involved in lots of other projects operating within their organisation that they had a commitment to. So target wellbeing wasn't their sole focus. And I think quite often, there was so much information there that was shared, via email networks that were set up. There was a website for projects to share information and that sort of thing. So the fact that the projects had other responsibilities, and also project staff quite often talked about constraints on their time. The staff were very often working part-time and sometimes had only kind of 2 hours free a week for kind of admin stuff because their time was so caught up in delivering these projects. So there were real limitations to how much information could be shared, I think.
Okay. Just my personal experience, I worked in the Ethnic Minority Support Project in Northern Ireland for about a year or two. And within that time, a Multicultural Forum was developed in the area, and it enabled a lot of different CVS organisations and statutory bodies to come together and share information monthly, basically. And so it also encouraged collaborations between projects as well. So that's been beneficial. Okay. Another question I've got is whether you had the opportunity to evaluate whether the intended target groups of the most deprived section of the population has actually benefited from the projects as a whole. That health improvement in that case.
Okay. So first of all, in terms of about who engaged with the initiative, was that your question?
Whether the targeted audience has been captured, as in whether it is the people who are most in need that have been signposted to the projects. And the second is how the health improvement will be evaluated at the end of the projects.
Well, first of all, that the project data that's collected that I mentioned, with project users' postcodes and that sort of information, that gives an indication about who's engaged with the project. And even though Target Wellbeing was focused on one particular town within this initiative, there were target postcodes that were targeted within the town. So they were interested in targeting specific wards where they knew there were particular pockets of deprivation. And looking at the postcodes of users, it seems that I think a lot of the projects have engaged some people outside of those areas. And the Big Lottery, I think, who funded the project, have been quite relaxed about that because, as the projects have said, it's really difficult to target very specific people when you're just trying to engage the public in activities that you're delivering. So very often, if they've run a community walk and residents have shown up from a more affluent area of the town, they've just gone with it. They need to get these activities up and running, and from their point of view, it's great that somebody benefits. I think this particular town, compared to others within the area, has been particularly good at engaging people within those target postcodes compared to some of the others. But again, I don't know how well it's reached the particular target wards. And in relation to the health outcomes, there is a broader evaluation of target wellbeing across all of those 10 areas that's using before and after questionnaires to ask people about their levels of physical activity and their diet, and then using exit questionnaires to explore whether that's changed after people have used the project. But they're not tracking individuals with their data. They're only able to take a kind of sample of project starters and project completers, if that makes sense. So, as I mentioned at the start, there's kind of real difficulty with trying to capture change with initiatives like this, and also, you know, the evaluators have said themselves there's going to be real difficulty attributing changes to the particular initiative. You know, many other things might have happened in the lives of these people that mean they've eaten more fruit and veg, not just contact with the project.
Thank you very much.
Anyone else got a question there?
I've got kind of comment and question, because when you presented last week, it was quite useful to have there was a woman from the CVS in the audience who said to you that actually it did resonate with her experience of being a CVS provider. And so I was just interested if there are some people who've been involved in target wellbeing here, which I think there are, Sue. Yes. Whether you know, the findings kind of are credible, I suppose, to some extent to you. Yeah.
Yeah. Yeah.
It's interesting. Okay, I'll ask another question if I've got time. No, I was just interested in that the concept you didn't use is social capital, which virtually everybody in public health talks about.
Yeah.
And I was just interested in whether you thought that had any mileage in kind of helping you explain. Because whilst service provider relationships might be characterised by competition, service provider resident relationships might be characterised by something else that might, I think the argument goes anyway, be through trust generate social capital in ways, I think you said, that might go beyond the duration of the project, might be a resource that's used. So it was really just some thoughts about that.
I think I do need to return to that and think about how it fits into the explanation about what's happening for residents. I think the examples I talked about today, I mean, some people would talk about those connections that have been made between residents and service providers as linking social capital, wouldn't they? As you said, giving people contacts that might help them, I don't know, access more resources again beyond that contact. So I'm not sure whether it is just kind of labelling something that they gain without really describing the ways in which people benefit from contact with those services. So you might want to label it social capital and say, yeah, they've got more contact with services.
But it's what they can then do with that.
Yes, yeah. So saying
back to work, it might be worth looking at it, particularly in something like those back to work projects where it led to, did it lead to that contact and the skills they developed and the confidence they developed through that contact actually generated something that was a bit more lasting or tangible.
So how they might use what we'd call social capital to benefit, Okay. Would you pass that to Diana?
Anybody else for any more questions? I think we'll leave it there then. Just to say once again, thank you very much, Katie. I'm sure putting all your writing into these few slides for us was a good challenge. Thank you very much.
Thank you.